Meanwhile, Canada's premiers are meeting tomorrow after the federal government offered them more than $46 billion in new healthcare money for the next 10 years. The funding includes an overall increase to health budgets, plus more money for individual deals with each province and territory. I spoke with New Brunswick Premier Blaine Higgs on Friday about the next steps. Premier Higgs, good to see you again.
Nice to be here, Rosemary.
So in theory, I believe the premiers are all gathering on Monday. What is the point of that meeting from what you understand? Because it does seem like people have different sort of ideas about what should happen next.
Well, yeah, I think that's probably true enough. At this point, we're happy to finally get a proposal. And I say a proposal, but it was kind of like, here it is. And it isn't a whole lot of discussion, but that's not unusual. Typically, that's how this works. So the next step is the only negotiating part is a bilateral agreement and what that looks like and what conditions we arrive on that we're going to measure for performance. And I'm quite all right with that because I think it's important now to put actual success and results behind dollars being spent.
So were you surprised that the amount was so far from the expectation of $28 billion a year? I don't know if that was a real expectation by the premiers, to be fair, but were you surprised?
Well, it is a far cry from what we were asking for. That's true. But I think there's a signal in all that. And the signal is that, we've all put a lot of money in healthcare over the last number of years. And we have to really find better ways to deliver healthcare, not simply try to put more money into it, because that hasn't been working. Yeah. So I think what the federal government is telling us is that you need to find more efficiency in the system because, we just can't keep pouring money in. And I guess that means that what we spend money on, and I'm fully supportive of this concept, is that we need to see that the patients and the people in the respective provinces feel the difference. Yep. And so where do we put that to make that happen?
I was actually talking to a specialist, a medical specialist from New Brunswick. I believe you ran into him at your State of the Province address, and he told me you gave him his phone number because he wanted his ideas. This specialist has got like 700 people on his wait list and can't take new patients and is looking for ways to innovate. So what kind of conversations are you going to have with people like him about ways to make this work better for everyone?
Well, if you look at New Brunswick as an example, we have two health authorities, Vitality and Horizon. And both of them actually, certainly, deliver healthcare services and in both official languages. So we don't need our two health authorities competing with each other. We need to complement their services. So we need to offer patients a choice. So maybe in the community you live in, you can't get in to have let's say, a knee operation for 2 years or a year. But you could go to the northern part of the province or somewhere else in the province, and you could get it done in the next month. Right. So give patients a choice to move around, to fully utilize their capabilities in the province. Those are the type of things that everyone will feel a difference.
It was Dr. McMillan, by the way, and he's got lots of ideas for you.
Yes, Mark McMillan.
That's right.
Yeah, I did talk to him last night.
Yeah. So how quickly do you think you can sign your part of the deal, and are you the side deal, and are you pleased that it is not being done per capita, that you're giving a large amount of money for the side deal to help you?
Well, certainly I am pleased about that. The reality is we do have the average age is higher here in the Maritimes, particularly in our province and in Newfoundland. I must say, though, our average age is 6 months younger now than it was because we've had such an influx of new immigrants.
Yeah, good.
So that's good news. But typically it is well known that, older demographics are higher demands on healthcare. So that recognition is important to us, and I am pleased about that. And I do feel that over the coming few weeks, we will indeed be able to arrive at a solution and a path forward with the federal government.
And do you have any additional requests from that? And I don't mean money, obviously, because as you said, it doesn't sound like there's more to be had. But is there anything from what you saw, the parameters that you saw, that you need to talk about more?
I think the shared priorities, as they're labeled, were something we can all get behind. The things that I'm more interested in on a national side is kind of best practices, sharing those amongst different provinces. The federal government may be playing a stronger role in the immigration file, so we can really target countries that have certifications that already meet our needs and bring the pipeline up. Looking at how it was managed during COVID in some ways, so that we can say, okay, this is an area that really needs help. It's behind. I just don't want to get into a competition between provinces for, let's say, personnel. That's not going to be helpful anywhere, but certainly not going to necessarily improve healthcare. So there's that balance that we're trying to strike. And the more you understand across the country of where the gaps may be most acute, the better we're going to be at raising all bars.
But before the meeting, when we talked before, about a couple of weeks ago, you told me that you were looking for a continuous funding model. This is a 10-year plan, although the 5% increase, the new floor is only for 5 years, although I know it'll be built in after that. Ontario has expressed some concern about the timeline, and I wonder whether you have those concerns, that there's sort of a 5-year issue and then there's a 10-year. Obviously, we don't know who will be in the federal government at those stages, but what about that timeline? Is that reassuring to you?
Well, I mean, I obviously like the focus on the continuous funding model and then the inflation piece that goes with that. So that is what's preferable. So I did get every indication that there's certainly a component of this that is continuous. And on the bailouts, I mean, if we have progress being shown there and there's money still required, I would feel pretty confident that that would stay focused. And the biggest demand or concern is that say, well, that the money we're giving has to go directly to improve healthcare.
Yeah.
Hey, we're all on page with that. So I guess I'm relatively optimistic that we'll strike a deal, and I'd like to get security on the long-term sustainable funding. But I think there's such huge gains to be made in healthcare delivery that we just have to be open to different ways of doing things.
Well, let me end on that then. The goals that you have to set for yourself while you accept those side deals, it does sound like they will have to be made public in some way, and that your citizens will sort of judge whether you've done a good enough job. Do you have an idea of what those goals will be and how you'll do that?
Well, I do. I mean, I'll go back to the hip and knee. If the national standard is one year wait time for critical surgeries, and hip and knee being, in that fall in that category of need, then I'd expect our province to be there as well. And so where are we now? And in some cases, I do know that we're a year and a half, 2 years, maybe even 2.5. Yeah. And so I want to focus that. And we started that program by weekend surgeries and moving them in remote areas that maybe have more OR time availability. And if doctors are willing to do that and really ramp up their OR time, look, we're going to put the money necessary to make it happen.
And you're okay to be judged on putting those priorities forward?
Absolutely.
Yeah.
I think we all should be judged on performance.
Premier Higgs, always good to see you. You're very kind to make the time, and we appreciate it.
You're very welcome. Have a great day.